What does informed consent for TMS, otherwise known as transmagnetic stimulation, look like? My name is Dr. Ruth Dotton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I'm going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. And one of the things that has come up is, what about TMS? So this is not a medication, but it is a treatment that we use in psychiatry and something that is worth talking about. So we call this a neuromodulatory intervention, which is basically something that is directly affecting your brain activity to treat your mental health symptoms rather than taking a pill. Other things in this category include ECT, which I've talked about in another video. So the TMS has several benefits over the ECT, which is why I think a lot more people are opting for this now. But basically, TMS is a non-invasive outpatient procedure that uses magnetic pulses to stimulate certain brain regions. This can lead to the release of certain neurotransmitters and improvement in neuroplasticity and other brain changes that can help with mental health symptoms. So what does it actually look like? You basically go to an office, you sit in a recliner, they put an electromagnetic coil against your head, and then it delivers magnetic stimulation to certain areas of the brain. Things like the dorsolateral prefrontal cortex, which is involved in mood regulation. Unlike ECT, one benefit is that there is no general anesthesia required. You can literally sit there and watch TV while they're doing this, and each session takes about 20 to 40 minutes. Like ECT, it's also a time commitment. A typical course includes going in for 5 sessions per week for at least 3 to 6 weeks. So there definitely is a time commitment that can be a barrier for some people. It's primarily used for major depressive disorder, but people are investigating its use in a lot of other psychiatric conditions as well, things like OCD, PTSD, and neurologic conditions as well, things like chronic pain, Parkinson's disease, migraines. Evidence shows that it's pretty effective for the treatment of major depressive disorder, and the side effects are relatively mild. So this might include things like headaches, maybe a little scalp discomfort, lightheadedness, sometimes facial muscle twitching. And what I hear people talk about most is kind of a little bit of cognitive dulling. It's not the same as ECT that causes frank memory impairment, but people do feel a little bit slowed over time. This can last for the duration of the treatment. And very rarely it can induce things like seizure and mania. So if you've tried a bunch of psychotropic medications and they're not working, or the side effects just make it seem that they don't seem worth it to you, then TMS might be something worth considering. And I'll say that this is probably becoming less of a last-ditch resort because it's so readily available, insurance is covering it, and as long as the patient can commit to the timing, it can be a potentially really good option for some people. If you've had an experience with TMS, I'd love to hear about it, so share in the comments below if you're comfortable. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email and I'll see you in the next one.